coronavirus. So there's lots of different kinds of viruses. There's a group of viruses called corona. Corona means crown, and they're called that because when you look at them under a microscope, they have these little spiky things. It's kind of like a ball with a lot of spikes, and those little spikes look like crowns. There's a lot of them. They infect animals and they infect people. So coronavirus is a broad general category. It covers a lot of different types of viruses. Some of the examples from the recent past are SARS and MERS, and we may have heard of those in the last few years. This one that is of concern right now has been labeled COVID-19, and so it is a subset of those coronaviruses. Again, you look under a microscope, they are round and they have those little crowns. That's what they have in common, but there's different ones. And so COVID-19 is a new one. We call it novel coronavirus, and novel just means new because until a few months ago, as far as we know, that was the first time that there was transmission to humans. So it is a virus that is transmitted through droplets, and so that means if you're close to a person and they have it, they might be breathing those droplets on you, particularly if they cough or sneeze, because that has a little force behind it. Those droplets move farther out away from the sick person, and so then they get on you, they get in your air passages, your nose, your mouth, and then they start multiplying inside your body. It is also possible that somebody who has that virus, maybe they sneeze and they put their hands up to their mouth for that sneeze, and then they touch the door knob or something like that, and then you come along and pretty soon after that you touch the doorknob and then you touch your mouth. It is possible that it is also spread like that, but the most common is going to be those droplets in the vicinity of somebody who's actually sick. So there's a lot that we don't know about coronavirus at this point. We do believe at this time that before people have symptoms, it is possible that they are able to spread it. And we're still learning a lot. It's a question that will be answered more as more research is done, but it is common with a lot of viruses that before symptoms, you can still be spreading the virus. So it is within the realm of possibility with coronavirus and is actually likely. So I think we still have a lot to learn about coronavirus, and we have learned a lot even in just the past couple of months. And what we are seeing is that children are not the highest risk here. There are some other illnesses where children are more at risk, but for COVID-19, what we are seeing is that the really severe infections and the death rate for children is not high. The biggest risk population seems to be older adults and people who have underlying health conditions, especially something respiratory. The symptoms of coronavirus are very similar to symptoms of other respiratory illnesses. So probably the first thing, it might feel a little bit like a cold. You get more and more congested. It might cause some shortness of breath and difficulty breathing, and also a fever are the most common symptoms. And it can range from a very mild illness to something that is life-threatening, and then as we know, it has caused deaths around the world. So one of the things that we're talking about is non-pharmaceutical interventions, and basically it involves a little bit of social distancing. So we're encouraging people, if you can, to stay just a little farther away from people than you usually do. 6 feet is probably a good distance. One of the main messages that we really want to tell people is wash your hands, and do it often, and do it long enough. Do it with warm water, do it with soap. The coronavirus has a little envelope around it, and soap helps break that envelope down and washes it down the drain and just kind of gets rid of that. So washing your hands really frequently, and we're talking 9-10 times a day, and most of us don't do that on a regular basis. So that's probably one of the biggest things, is washing your hands, staying a little farther away from people. And one of the things we really, really, really want to encourage people to do right now is, if you are sick, please stay home. If you're experiencing symptoms of a respiratory nature, so that means maybe you have some congestion, it's starting to feel like it's in your lungs, you have a fever, you might be starting to feel shortness of breath, and you think it's possible that you could have the new coronavirus, COVID-19, what we want you to do is stay away from other people, but also seek the care that you need from your healthcare provider, or if it's life-threatening, our local hospital. But we want you to give those people a heads up. We don't want you to just show up and walk in the door. So if you think that that could be your diagnosis, we want you to call ahead. We want you to tell them that you think that might be what you have, and they would likely make a very different plan for you than having you just walk in the door and sit with a lot of other people. So it could be that they would come to your car, do an evaluation there. It could be that as soon as you're in the door, they want to give you a mask so you're not spreading that virus to other people. And of course, if you're making an emergency call to 911, we want to protect our first responders so that they protect themselves when they come to help you. So that's a really interesting question, and I do think that there's a lot of information that's out there for people to have, and what we really want to do is make sure that people have the best information they can get, that they're getting it from reliable sources. I too like to follow what's happening on Peeps, and it helps me to understand what people are thinking in the community, but I also want to approach that with a little bit of a caution, because I've seen things that are out there that are just not true, and I've also seen things that get posted that are actually harmful and dangerous. And so we do have some links on mynevadacounty.com/coronavirus that people can go and look at, that'll give you some links to better sources of information, like the Centers for Disease Control and Prevention, like the State Department of Public Health. And what we have committed to do is to give the public the information that we feel is going to help our community to be ready and to prepare, and also to not panic. One of our best partnerships in our community is with 211, our connecting point, and so they are actually functioning as a communications hub during this time with COVID-19. So we're asking people who have general questions to call them. We're trying to make sure they have the most accurate, the most up-to-date information, and people can make that one call, 211, and be able to ask questions and get questions answered. And we do know that one thing that might be of concern to people is if they're sick, they don't have a health care provider. 211 has some information to connect them with some of our local clinics, such as Western Sierra Medical Clinic or Sierra Family Medical Clinic out in North San Juan. So 211 is a good source of information. If that doesn't work for some reason, the other number that they have is 1-833-DIAL 211. So they're pretty easy to get in touch with. They're well informed. They'll refer people. They'll help connect people. And it's both the western and the eastern side of the county. They're a great community resource now during this time where there's a lot of activity around COVID-19. They're also a great resource at all times for our community.